and welcome to this short session which is focused particularly on sciatica. So I'm putting this video on both the pregnancy yoga and the postnatal yoga channels because although sciatica is unfortunately something which a lot of pregnant women do struggle with, it's not limited to pregnancy and you can experience sciatica and sciatic nerve pain at any point in your life. So it might be that these stretches I'm about to show you are useful for you whether you're pregnant or not. So what is sciatica then? We hear a lot of people talk about it, it seems to be very common. So sciatica is basically any kind of pain that is derived from pressure being placed on the sciatic nerve, and your sciatic nerve runs down your back, down the back of your bum and down the back and side of your leg. So it's a big long nerve, and the pain that you experience with sciatica can be quite distinctive and quite unusual. So it can present itself as like a pins and needles type feeling, usually down the outside of your leg, maybe the bottom half of your leg, sort of like your calf area, and into your foot as well. But it can also feel like sort of shooting pains as well, down the back of your thigh. So it can present itself in different ways, and it's often worsened by sitting down for prolonged periods of time as well. Now, it's something that can often be mistaken or confused with pelvic girdle pain, which is another, unfortunately, fairly common symptom of pregnancy. And so a lot of people end up going undiagnosed with pelvic girdle pain because they just think it's sciatica. So just be aware of those particular sensations that we associate with sciatica. If it is just general achiness and discomfort in your hips, it might be worth watching the video that I've created specifically about PGP, just to check that you are working out towards the right thing and you're not focusing on the wrong one. So it's caused by a number of different things. Basically, it's anything that's pressing on your sciatic nerve to cause the discomfort. So the most common form of sciatica is where a muscle called the piriformis muscle, which runs along the top of your bum, is quite tight, and so that is putting pressure on the nerve. So this type of sciatica we can do something about. There are a number of stretches that I'm going to show you today that are designed to stretch out that piriformis muscle and therefore alleviate some of the pressure that can be placed on the nerve. Now, it can also be caused by a slip disc or a herniated disc in your spine pressing on the nerve. Now, this is obviously something that's a little bit more serious and we can't help with stretching. So my advice to you would be, if stretches don't alleviate the discomfort and it's something that continues over a prolonged period of time, it's definitely worth going to see your GP just to check that there isn't an underlying problem that's causing your sciatica. Now, the reason why we think a lot of women experience sciatica a little bit more in pregnancy is because, as well as this piriformis muscle pressing on your nerve, you've also got a baby on the other side that can sometimes be putting a little bit of pressure on the nerve from the inside as well. So it tends to be a bit more common towards the latter stages of pregnancy, when your baby's head is down in your pelvis and therefore kind of moving around and putting pressure on different parts of your body. So sometimes it can worsen the pain. Now, we can't do anything about that. We can't encourage your baby to not press on your nerve, but we can, as I said before, do some things to help stretch out that piriformis muscle, which can help to prevent you from experiencing sciatic nerve pain. Now, it's really important to note that if you're actually experiencing a flare-up of sciatica, then it's not advisable to do these stretches at that time. So if you are experiencing the pain currently, if you feel that you've got a bit of a flare-up of it, the best thing is just to rest, to not put any unnecessary stress or strain on those muscles, because you're effectively just stretching muscles that are already inflamed and aggravated, and you by stretching that piriformis muscle you will be putting pressure on the sciatic nerve, so it's not really going to do any good. The way that these stretches are really effective is using them regularly in between flare-ups of sciatica, and therefore you can gently stretch out that muscle and eventually prevent those flare-ups from occurring. So don't do the stretches if you're experiencing sciatic pain currently. Do the stretches when you're not experiencing a flare-up, and they will help to prevent it. Okay, so let's get started. We've just got a few little stretches that I can show you, most of which don't require any equipment or any props whatsoever. So just starting in a seated position, if you bring the soles of your feet together and just allow your knees to open out to the side, what we're doing here, this is called cobbler's pose, and you should feel a stretch down the inside of your thighs and your hips, but we're also just gently stretching out that muscle across the outer hip, the piriformis. So staying in this pose for a little while, just allowing gravity to help open those knees out, let them fall down to the floor, will really help. So this is one that you might want to just kind of spend a bit of time in, sitting in this pose while you're watching a TV or something, and just gently allow the hips to open up by themselves. So anything involving the hips, we have to give them time, we have to be patient and allow the tension to just melt away. So cobbler's pose is your first one, and it's quite a passive pose. You know, we're not pushing into this at all, we're just letting gravity do its work. So this is one way that you can help to gently begin to stretch out the piriformis muscle. Okay, we can also take staff pose, which is where we sit up nice and straight and we have the legs straight out in front. So just pointing and flexing the feet, we're beginning to stretch out the hamstring muscles. So all of the muscles down the back of the legs, it's a really good idea to help stretch them out to keep them in good working order, so there's nothing there to put any pressure on that sciatic nerve. So staff pose, again, it's a nice passive pose. We're not pushing into it too much. You're in control of how much you're going to stretch out those muscles. Maybe taking some little circles with the ankles, just getting those muscles in the back of your legs moving around can help. Okay, final pose in the seated position. So we're going to have one leg out in front, and we're going to take the other leg and cross it over. And then we're just going to slide it across as far as we can, okay? So the aim is to have the knees together, but don't worry if you can't get it that far across. So this is called half cow face pose. I have no idea why it's called cow face. I don't think it particularly looks like a cow's face. But what this is doing is it's stretching the piriformis muscle. So it's stretching that muscle all the way across the top of your bum and stretching out the outside of your hip. So this again is another one to stay in for a little while. This is more of an active stretch, okay, so you should feel this a little bit more than in those other two. So I would hold this for maybe 10 breaths in and out, just allowing those hips to stretch out. So it's the outside of the hip that we're working on, and in pregnancy yoga we tend to focus more on opening the hips, the inside of the hip joints. So this is just a slightly different way of stretching. Okay, we'll just have a quick go on the other side. Remember, when you're doing this yourself, you can take your time, you can spend as long as you want in these poses. So again, just crossing one leg over the other so that the knees are together, and you should feel that stretch down the outside of that hip. So give it time to work. It might feel nice just to kind of gently rub or massage the outside of the hip as you're doing these stretches as well. Just helping those muscles to warm up will assist them in stretching out safely and comfortably. So again, hold this for the same amount of time that you held the other side, so maybe counting 10 slow breaths in and out. Okay, so those are our seated postures that you can do, so they're just nice and gentle. We're going to come to a tabletop position now, and I'll show you a few different stretches that can help with your sciatic nerve pain from that position as well. So just coming onto all fours. Remember, whenever we do our tabletop position, if you need a bit of extra padding under the knees or the wrists, you can always fold over the edge of your mat or provide yourself with some extra padding from a cushion or a blanket or something. Okay, so all we're going to do here is we're just going to take one leg back, keeping those toes down onto the floor, and just gently push back through the heel. So this is another hamstring stretch, slightly more active than the one we've just done, because you're gently pushing back. So you're completely in control of the stretch, but you can push back until you feel that muscle tightening, and just hold it there and give it some time just to release and stretch out. So we can do this on both sides. Again, you can hold these for a bit longer when you're doing them in your own time. I'm just demonstrating them quickly for you now. So that's just a nice gentle hamstring stretch. Okay, and then bringing your big toes together, take your knees nice and wide apart, sink your hips down to your heels and relax your upper body down into child's pose. So depending on the size of your bump, there are different ways that you can get comfortable in child's pose. So you might find it quite comfortable just to let your bump rest in between your thighs and melt your upper body down to the floor. If this feels a little bit too restrictive, you can have some pillows and cushions or a bolster to rest your upper body on. Or you can use, if you've got a birthing ball, you can just use one of those to come forward. But the important thing is that we're feeling a little stretch again down the outside of that hip. So just let yourself rest in child's pose. Again, maybe for 10 breaths in and out, just to help and allow those muscles to stretch out nicely. Another stretch that can help with sciatic nerve pain is downward facing dog. So beginning in child's pose, so your big toes are together and your knees are apart. Just going to reach forward with your hands and spread your fingers nice and wide. Rock your weight forward slightly and just walk the knees in a little bit closer together. Tuck your toes under and then slowly begin to lift your knees up and take your hips up and back. So take your feet a little bit wider, so you've got plenty of space there in your hips. And really just play around with the pose, so there's no need to keep it still. You can keep it nice and moving. Maybe take your hips from side to side. Maybe pad your feet out one at a time. Slowly stretching out those hamstrings. And also having a nice stretch through the back at the same time. So from here we can move into another of our stretches, and that's a low lunge. So take a step forward. Obviously you can get into this pose any way you want, you don't have to come to it from downward facing dog. So we want to have one leg forward and the other leg back with the knee down on the mat and the foot flat. So if it's a little bit too uncomfortable to be down on your hands here, you can use something to keep you a little bit more upright. So for example, a ball might help. So I'll just bring the ball in to show you how you can use it. Okay, so we can still have the lower body in the same lunge position, but you're nice and upright, so you've got plenty of space there for your bump, and your back is nice and upright as well. You're supported with the ball. So we're just sinking the hips down here. Again, we're getting that nice stretch across the outside of the hip, and it's a great hip opener as well. So just swap sides, make sure you do the same on both sides if you are doing a lunge. So just melting those hips down and keeping yourself nice and upright. Lovely, okay. So another pose which is really good for sciatica, but very much dependent on how you feel and whether you feel comfortable doing it or not, is pigeon pose. Now there are some varieties of it, and I will show you a different variation in a moment, but this is the traditional pigeon pose. So starting in a tabletop position, We're going to step the right foot forward, and then we're going to take this foot for a little walk over to the left hand side of your mat. Okay, so shuffling it across, and then allow the right knee just to come down onto the mat. And then you can slide this foot a little bit closer in towards your hip if it feels more comfortable. And just take a moment to straighten out your back leg and feel your hips melting down towards the mat. And then from here, you can lower yourself down to wherever feels comfortable. So you should have plenty of space here for your bump, but again, it depends very much on how big your bump is at the moment and if you're feeling up to doing it. So only try this if you think it might feel nice for you. But this is the strongest stretch that you can get on the piriformis muscle, so it's really stretching out that muscle. And pigeon is definitely the pose that we talk about the most often when we're talking about sciatica and relieving those symptoms. So I'll just show you how to get out of the pose. So you're going to slide your back knee a little bit closer towards you and gently release the leg. And we'll just do the other side once again just to show you. So step the left foot forward, take the foot for a little walk across the mat, lower the knee down, slide that foot in a little bit closer towards you, slide the back foot a little bit further away, and then come to wherever is comfortable with your hands, taking that stretch over into your left hip this time. So that's pigeon pose. There are different alternatives. There is a reclined version lying on your back, so I'll show you that one in a moment. So just carefully coming back out of the pose. And we'll finish with a few stretches that you can do lying on your back. So it is safe to do a little bit of work lying on your back as long as you're not staying on your back for a prolonged period. So when we do relaxations, for example, we advise you to prop your upper body with a bolster or some pillows just to keep your heart raised up. But for 5-10 minutes you can quite safely lie on your back to do a few nice stretches. So I'm just going to show you some of those stretches now that you can use. So just lying down on your back, taking your feet about hip distance apart and sliding them in nice and close towards your hips. Place your hands down on the mat with the palms facing down. And we're just going to slowly push down into the heels and begin to lift the hips up and lower them back down. So it's just a nice slow rolling bridge pose, lifting and lowering. So we're not holding our hips up high. We're moving up and down, so you might find it nice to move with your breath as you breathe in. Feel those hips gently lifting up, and as you breathe out, allow them to lower. So we're strengthening the muscles in the front of the legs, we're also strengthening the glutes as well. So all of those muscles surrounding where your sciatic nerve is, we want to keep them in good working order, so nothing's going to be tight and tense and therefore putting pressure on that nerve. Okay, so that's a nice gentle rolling bridge pose, and you can do that for as long as you want because it has loads of benefits with your pelvic floor and also your lower back. So it's just generally a really nice one for you to do in pregnancy and also postnatally as well. So I'm going to show you a reclined version of pigeon pose, which we did just before. So beginning exactly as we are now, with both the knees bent, we're going to take our right leg and take it up towards the ceiling. And then we're going to take that right ankle and cross it over on top of the left knee and allow that knee to come out to the side. So what we're doing here is effectively the same as what we were just doing when we were lying on our front, but it is a little bit gentler, a little bit more comfortable and a little bit easier to get into as well. So this is your alternative. So just gently allowing that knee to fall out, maybe putting a little bit of pressure on the inside of the thigh with the hand, you're getting that piriformis stretch again. You can make the stretch a little bit stronger if you want by just gently lifting up the other foot and drawing that ankle in a little bit closer towards you so you'll feel that stretch intensify slightly. So I'll just show you on the other side. Taking the foot up into the air, crossing the ankle over on top of the knee and just letting that knee fall out to the side. Giving it time to open up the hip, and if you want to, you can lift the right foot as well, just to feel that stretch down the outside of the hip become a little bit stronger. Perfect.